All right, welcome everybody to our Thyroid Reset Masterclass webinar. And the reason we're doing this is because we want to talk to you all about thyroid during this time. So, one of our big goals is we want you to be the CEO of your own health because the times that we're living in right now, if you don't take control of your health, no one else is going to do it. So, my motto is why not now? Sometimes later becomes never. So, this is the time now. And so, who are we and why are we doing this? So, I'm Dr. Linda Marquez Gedine. I'm a chiropractic doctor, also certified functional medicine practitioner. Been in the business for over 25 years and love doing this, helping women find the root cause of their problems and giving them some doable, step-by-step solutions for what's going on with their challenges in their body.
And I'm Dr. Lucinda Mallory, pleased to be with you. I'm from Seattle Bastyr University. I'm a naturopathic physician for about 29 years now, and very extremely well versed in natural medicine for women, women's health care. Have a board certification, diplomat in anti-aging medicine, bioidentical hormones, anti-aging restorative medicine. So excited to teach you guys.
All right, so our purpose basically here is to be able to share this information with you in a way that you can understand it, in a way that's very applicable. So that's our purpose. One is to educate you, but do it in a fun way. That's what edutainment means. Empowerment. And empowerment more is to give you the tools, make you feel that you can do this with the help of the right team. So that's why, we are doing this. We don't ever want you to feel like you're less than, because so many people go to doctors, especially women, and they really get dismissed by their practitioner, especially if it's a male practitioner. They get dismissed, and it's like your symptoms really aren't a big deal. Your labs are normal. So that's why we see a lot of millions of women. They're taking thyroid hormones, but they don't feel normal. They might feel well for a little bit, and then they feel bad again. So that's why they're being dismissed so much. And as we see here, why millions of women are taking thyroid hormones, but they fail to feel normal again. And it's no matter what their labs say, and there's so much truth to that. So what you're going to learn during the next few 30 minutes or so is what is a thyroid, why it's important, what happens when it doesn't work, why your practitioner may not be treating you correctly, and sometimes it's not their fault, and what can you start doing today to start optimizing your thyroid. One of my favorite quotes here: surround yourself with the dreamers, the doers, the believers, and thinkers, and most of all, surround yourself with those who see greatness within you. And I'm so glad that you're here because you sometimes don't see the greatness in yourself, but we do. And that's why it's important to have a team. And we're hoping that you're going to be joining us for all our other webinars. So, what is the thyroid and why it's important? And Dr. Lucinda is going to share about this.
Yeah, so as most of you know, your thyroid gland sits in your neck and it produces one of the most powerful hormones in your body called thyroxine. And this hormone is the regulator of all your fuel burning in your body. It helps to burn fat, it gives you energy, it gives you the warmth, it gives you your mojo. So it's very extremely important.
Yeah.
It controls so many things in your body. All your cells have, all your tissues have receptor sites for thyroid hormones. And of course, it impacts your gut, your brain, your skin. Every tissue in your body is extremely important, and we'll go into this more. So, and how it works too is each cell, each tissue has receptor sites for your thyroid hormone, and it's likened to a key in a lock. It opens it up, and once the particular thyroid you're using is sufficient and optimal, it will open up, and your receptor site will get filled up, and you will be doing well. The problem is getting to this. What does the thyroid do? Well, the thyroid does act like the CEO, the chief executive officer of your body and of your cell. It impacts so many tissues. It helps you with weight loss. It impacts your hair, your skin, your body temperature. It impacts how you digest your food, the rate of peristalsis, how often you can go to the have a bowel movement. It impacts your mojo, your sex drive. It impacts how you focus and think. Your memory, it's huge. When people have poor thyroid activity, they don't remember things very commonly. It impacts fertility. We know that low thyroid causes very heavy periods in women, dysfunctional uterine bleeding, and causes very strange and odd cycles, and even can impact your ability to ovulate. So it indeed does impact every cell of your body. How it works. Well, the thyroid has a feedback system to your brain. So the thyroid emits T4, and the thyroid hormone T4 goes back up to your brain and releases thyroid stimulating hormone. So even though that appears to be what commonly checked, it's not everything, but still we wanted to show you in this picture how it does affect your brain and how your brain picks up on whether or not you have a sufficient amount of thyroid. Your TSH will increase if you are not if you're not producing an optimal amount. It will decrease as your levels increase. If your T4 increases or your T3 increases, your TSH is suppressed. So very important. And then some real basics. Thyroid stimulating hormone comes from your brain. We'll talk more about this in the future in our classes. T4 is the storage hormone, but this is from our thyroid. And then these are some of the labs that we do that you should always get checked with any of your practitioners. And if it's not done, then you're not getting your labs done correctly, and that's what we're going to be teaching you. Very important to have a healthy liver and intestinal tract for conversion of thyroid. So not only does your thyroid need to produce a certain amount of thyroid hormone, thyroxine, T4, it also has to go into your bloodstream and get converted. And conversion happens mostly in your liver and muscle, and then some in your gut. So it's all really important. Some of it will get converted to what we call reverse T3, and we'll talk about that more at length. So that's why it's important to check for all those.
This is one of my busy ones. What fits your busy schedule, doctor? Exercising 1 hour a day or being dead 24 hours a day? That's the importance of why we need to take care of our physical body. So what happens when it's not working? It's sluggish. A lot of times it's the wrong dosage, the wrong hormone. That's one of the reasons why your thyroid hormones don't work. Or thyroid isn't working at its optimal capacity. So you're still going to have a lot of hypothyroid symptoms, and that's pretty much what we're going to be talking about. Hypo means lower thyroid symptoms, and then hyper is more higher. So the hypothyroid, also known as a slow functioning thyroid, is going to affect, you're going to have a lowered sex drives, hair loss, weight gain. That's the biggest reason a lot of women come in, is because they're like, I'm gaining weight, I'm doing what I used to do, and it's not working anymore. So that's why you have to look at the thyroid. They're tired a lot, and as Dr. Lucinda mentioned, there's constipation, and a big dead giveaway is the cold hands and feet. They start losing the lower 1/3 of their eyebrows. They're depressed. Their cholesterol markers are elevated. They can't sleep. Their nervousness. They're anxious. They have heart palpitations. They have slow digestions. They have headaches that sometimes disappear by the afternoon, and they have a lot of problems focusing. They just can't focus, and they're almost like checked out. And I'm sure you've seen this in women, mostly in the office. It's like they're there, but they're not all there. So other than that, I always say they're normal. They're feeling great. So that's a lot of problems and a lot of symptoms that you have when your thyroid isn't working properly. And the sad thing about it is, Over 20 million Americans have some sort of thyroid disease, but 60% of them are unaware of it. So you could be one of them that you have a thyroid issue and you don't even know it. And you usually are told, especially, women are usually, as I mentioned earlier, they're dismissed and they're like, your thyroid's not, you're fine, everything's great. But as Dr. Lucinda mentioned in previous slide, that all the proper testing isn't being done. So 1 in 8 women will develop, that is, will develop a thyroid disorder in their lifetime, whether it's a slow functioning thyroid, whether it's Hashimoto's, whether it's cancer, whether it's hyper, um, uh, uh, you know, um, it's not working to its optimal capacity, the hypo. So they will develop that condition. 80% of the women, or 80% of people with hypothyroid, are women. That's a huge number. 8 out of 10 that have a thyroid condition are going to be women. And I know personally in my clinical experience, it has been mostly women and a handful of men, but primarily women. And up to 10% of the women will have, that are over 60 years old, have clinical or subclinical hypothyroidism. And we're going to talk more exactly what that means. It's like you have all the symptoms, but according to the labs, that your doctor's like, nope, your labs are good, but yet you have a lot of the symptoms that we just talked about. 90% of these hypothyroid patients, the ones that their thyroid's not working at its optimal capacity and is working very slowly, they have antibodies. And antibodies, we'll talk about that, about producing antibodies, because their thyroid is under attack. So why are we having so many thyroid problems? Stress, inflammation, as we talked about earlier, gut health and poor liver function. And stress comes in many different forms, from chemical, emotional, and physical. Chemical is everything that we're putting in our bodies, on our bodies, and everything that's surrounded around us. So as you can see, a lot of the meats have a lot of animal products that you eat are loaded with pesticides and herbicides because you are eating what they ate. So it's always wise to choose organic, grass-fed, wild-caught, anything that's with the number 9 label on fruits and vegetables. There is a website called EWG, it's the Environmental Working Group.org, that does have a list of even cleaning products, beauty products that are all safe for you and for the environment. And emotional stress, work, family, social status, finances, those are some stressors that contribute to how your thyroid works. And this is often overlooked. Physical stress, if you're not sleeping enough, or you can be sleeping but you're not getting into the deep sleep, or you go to bed but you're waking up like every hour. So inactivity, if you're sitting around all day, a lot of the new smoking is now just sitting all day. So that's a big issue. And then physical stress with the EMFs, which is electromagnetic frequencies, which are our phones, our computers, and so forth. So, it's different than it was 20 years ago, 30 years ago, 40 years ago, and we are having more and more problems with thyroid issues because of the demands of life, and how we choose to participate in that. So, as a result, stress makes this hormone called cortisol. Cortisol is made by these little tiny glands that sit on top of the adrenal glands that sit on top of your kidneys in the lower back. So what happens is, when cortisol is made, one, it interferes with how your brain functions. Two, it interferes how that inactive hormone is converted to an active hormone. Three, remember that picture of that key in the lock? Well, it's damaging that receptor site. You can't even put the key in there. So that's what stress also does. And then it'll increase reverse T3, and that's another reason that it'll block that ability for that key to actually go into that door. So there's a lot going on when we look at stress, and people will just say, well, I'm just stressed. Well, there is no just stressed. Stress does impact your physical body, your emotional body, and so it is a big issue. And the big one here, it does impact your gut lining. You do get leaky gut, and all that means is intestinal permeability. You actually have holes in your gut, and you're not going to be able to get the maximum nutrients from your food. And I kind of equate that to, if you have a car with holes in its gas tank, you're putting in the best gas in there, but you're not getting you're not getting the maximum mileage on your vehicle because there's holes in the tank and you're losing your fuel. So that happens a lot with leaky gut as well. So talking a little bit about you know, if you are on medication. So there's a lot of patients that need to be on medication, and there's some that don't. And if you are on thyroid medication, a lot of the times, some women have been on it for years. I've talked to them, and they've been on it for 20 years. And I'm like, what are you taking? And typically, it's a T4 medication like Synthroid. So you have your T4 medication. Remember, we talked about the T4 hormone that is not active, so they're just putting more inactive hormone in your body. The T3 medication is the one that's like opening that, putting the key and opening the door, so to speak. And if you're only getting the T4, it's not really, and it's not being converted to that T3, it's going to be an issue. That's why we see a lot of women that don't do well and they're on the same medication, but sometimes they just increase the dosage and they're not really getting any better. But because their labs look good, they stay that way. There's a this is Cytomel, which is a T3 medication, which some doctors will dose that according to what the patient needs. And then this is one of the other more popular ones is the T4, T3 medication, which is often used with a lot of patients that have had cancer, had part of their thyroid removed, or Hashimoto's as well. Most women tend to thrive on that, but we don't see a lot of that. So cortisol from stress, as I mentioned, it kills your brain cells, shrinks the brain, and it leads to dementia, causes depression. So it's going to be important that we all learn how to manage stress, and we definitely are going to give you a lot of strategies and opportunities for that.
So, while your practitioner may not be treating you correctly, as we said before, they look, most practitioners out there will look at the ranges. So when you go in with your lab work, with your thyroid hormones, especially, and they'll only check it, usually only check a TSH, thyroid stimulating hormone, and a T4, a thyroxine level. That's about it. That's all you get.
Mhm.
Um, and the reasons why it's really quite it's totally incorrect to look at it this way, because if you are inside of those ranges, they just tell you that you're fine and you walk out the door, nothing's done, or they might give you a prescription for the thyroxine. So what functional medicine doctors look at, and what we're trained to look at, is listening to your symptoms, because listening to your symptoms are way more important than looking at your labs. So a lot of women, most of us have what we call conversion disorders, and a real good name for that is um, subclinical hypothyroidism. Subclinical meaning it's not going to be on those ranges that we looked at just a moment ago. If you're not in the range, then you are subclinical. So you can still have hypothyroidism. So that's when you start thinking about, okay, I need to go to a healthcare practitioner, a functional medicine doctor like ourselves, or how we teach you, and really look at what these numbers usually mean. So these are just a list of labs that we may look at, and roughly the ranges, we have a tighter range numbers that we look at, a lot more important. So we are more, we're looking at different numbers. We like the free T3 to be over 3.8 for sure, and maybe up to 5, depending on the patient. So all these lists, all these different labs you see here are important to check. And quite a few of hypothyroid patients. So Hashimoto's is what we call autoimmune hypothyroidism. So that's when your thyroid's being attacked by your own body. And that can happen from a gut issue for sure. It's very common. So when you're eating gluten and you're eating food allergens, and you have an autoimmune tendency, very very common for your body to create antibodies that will glom onto your thyroid, and then your body attacks itself. So that's what we're really good at, is helping people come out of Hashimoto's. And it's not something that you want to live with. most allopathic physicians will tell you that you're stuck with it and will just give you thyroid hormone, the synthetic one, once your thyroid's not working. And there's so much more you can do to correct this with your gut and your immune system.
Yeah. And one of the things here that I always try to mention to patients, and this is the issue, because these antibodies are often not checked by doctors, by the time a person does find out that they have Hashimoto's, they've come to us, I kind of equate it to when you have Hashimoto's and you're having an immune response, when when your thyroid is being attacked, it's almost to equated to like it's taking chunks out of your thyroid. It's destroying your thyroid. So now you have less of a gland to work with. So, and if you have less of it, guess what? It can't produce as much thyroid hormone as well. So this is like this is huge right here, what Dr. Lucinda was talking about, because over time, your thyroid, you're losing it. It said chunks are being taken out, and I have to be graphic sometimes because patients don't understand it, individuals don't understand it. But when you understand that hypothyroid can be Hashimoto's and you're actually losing thyroid, that's an issue. And it's really important that the proper testing and investigation is done.
So what's not being considered by most allopathic practitioners is the integrative approach. You look at the whole body, you look at the patient's stress, you look at their diet, you look at their level of inflammation, their gut, asking them about bowel movements and digestive health, and also looking at their liver, because if they're high insulin, they've got some fatty liver, they're not going to be able to convert any thyroid hormone they have, whether it be synthetic or their own endogenous level of thyroxine, they won't be able to convert it. So they really do have what we call subclinical hypothyroidism. It doesn't have to be classical all the time. And again, if the liver's fatty, like this lady has a fatty liver, if you eat a lot of carbs, have a lot of sugars, when your labs come back, your liver enzymes, and they're a little elevated and you don't drink, it's a common problem. It's the high insulin is causing fatty tissue to build up in your liver, and when it's built up in your liver, then your body can't convert the thyroid hormone for you. What other reasons is conventional medicine failing us? They're not checking thyroid correctly, but they're not checking any hormones correctly. They don't know how to do this. Basically, so they will check for thyroxine, which is a T4, and TSH, and that's about it. Rarely will a physician check for a free T3. You have to go in there and you have to insist. And then sometimes you insist and they only check a T3 because it's not even on the lab form. So they also don't check for antibodies commonly at all unless you ask them. They won't test for reverse T3 for the storage form. That's what stores. If you have high cortisol, it stores T3 as reverse, and your body can't use reverse T3. It's a storage form. Mm-hmm. And then they don't understand the ranges, and the ranges are outdated. And your primary doctor, who probably did some labs like a TSH and T4, they don't really understand it. If you have something that looks odd, they might send you off to an endocrinologist, might do some more, but endocrinologists don't even do what functional medicine doctors do. Mm-hmm. And they also obviously don't look at your body as a whole. They're not looking at your stress, the fact that you have a fatty liver. They don't look at your diet, nothing like that. So that's what we do. That's what we plan to teach you. Okay. And then medication, other things.
Oops.
Okay.
There we go.
Okay, all right. Other things. Okay, they don't, like I said, they don't look at insulin resistance. Insulin resistance is when you are pre-diabetic or diabetic. If you have high insulin, it means your blood sugars are over 95 fasting, or perhaps your A1C is going to be above 5.6, 5.8. That just shows that your insulin's sitting in your bloodstream along with your glucose, and you will not have a good thyroid activity at all. So, we said back there, mentioned back a few slides back about how 1 in 8, I think it's 1 in 2. I really think that I think most women that I see in my practice for 28 years, I think they all have a thyroid issue. I honestly do. And even if it's a mild conversion disorder, most everybody does. Because think about it, most people have blood sugar problems, most people have stress, etc. The women that are pregnant, they do really well because they have all that progesterone helping them. And then when you go into menopause, of course, you also don't have your hormones to support your thyroid any longer. So other reasons, nutritional deficiencies, digestive issues can totally cause thyroid issues as well. And conventional medicine doctors do not look at that. The allopathic medicine they don't get trained in how to look at the gut and your microbiome. They have no idea. The food allergies, check a lysa test, which doesn't tell you any intolerances. It just tells you if you have an antibody response. And that's definitely not enough information.
And that's the biggest thing with why conventional medicine is not working is because, as you mentioned, and rightly so, probably it's more like 1 in 2 women have a thyroid issue because the gut is impacted. And most everyone that we see in our practice have gut issues. I personally have gut issues, and I've done things almost perfectly. However, there's stressors in our life that also impact us and will impact your gut as well. So I totally agree with you, and I know there's a lot of women that do and men that have that issue. So symptoms are not our enemies to be destroyed, but sacred messengers who encourage us to take better care of ourselves. And that's so true. It's like, when do we make a change until it's really bad? And by then it's a problem. So what can you start to do now to optimize your thyroid? So one of the things that I always you know talk to my patients about, I know so do you, Dr. Lucinda, is about, especially with Hashimoto's, it's stress induced. Sometimes there is a genetic predisposition to that. The leaky gut caused by stress and foods. We have a lot of autoimmune triggers. Food sensitivities would be one, like gluten, wheat, oats, rye, barley, any of these grains. A lot of time, even dairy, and dairy's a big one there. MSG, toxin exposures. We're getting toxins in our environment every single day that are considered safe, but there's really no testing done. It's like, well, you pay someone off, then it's deemed safe and you can use it. Chronic infections, poor stress response, pregnancy, divorce, loss of home. We're always going to have some sort of stress in our life, but if we don't know how to manage that, that's going to impact your health as well. So these are some other things that cause your thyroid to malfunction that are often overlooked. Heavy metals, sometimes imbalance of hormones, lack of iodine, I would say birth control pills for a lot of young gals that start that, liver issues, not getting the proper nutrients, iron, ferritin, vitamin A, B, C, D, magnesium, selenium, zinc, iodine. Once again, we mentioned about if you have a leaky gut and you have a tank that has holes and you're putting gas in it, you're not going to get the maximum mileage on that. It's the same thing with your gut. You're putting in this good food. However, if you have a leaky gut, then you're not going to absorb the nutrients at its maximal capability. Thyroid issues, remember we talked about the receptor sites. You can't put the key, you're putting the key in the door, but it's sticky and it won't open up. So there's a lot of issues even just with the receptor site, estrogen imbalances, stress, and even medication. There's different types of medications that will impact your thyroid. So the goal is always to get you healthy to lose weight. Most people go see a doctor because they're like, I'm gaining weight. And when they come to see us, it's usually the thyroid is one of the common denominators. And we don't tell them eat less, exercise more, like most doctors will tell you, just eat less and exercise more. And they're like, I'm already eating less and I'm already exercising a lot and nothing's changing. And you actually can be making the problem worse because of the stress and the cortisol levels, which will further impact how your thyroid works. So The action plan really is know what your blood test markers are. We gave a list there of, the free T, 3, 4, TSH, but also knowing your antibodies and other relevant blood test markers as well. You want to remove the gluten, sugar, soy, alcohol, legumes, nuts, and seeds. And alcohol is a big one because it's got to go through the liver. Now, legumes, like a lot of beans, sometimes some women will do okay with lentils, mostly nuts more than seeds. However, sprouted nuts usually do better, sprouted seeds as well, because they're easier on the digestive tract. And then you can reintroduce these. If you think that you have autoimmune without being tested, or even if you know you have autoimmune, you probably should be removing the eggs and dairy because those are very inflammatory for a lot of people, and you're not going to know until you actually remove it. Make sure you get your sleep dialed in. You're getting quality sleep. You're getting to bed at a decent time. I recommend most patients get to bed by 10 o'clock. There's a lot that happens while you're sleeping. Manage stress. Get your exercise in. It's important. Our bodies were designed to move, and 5 days a week you can do that. You can split it in half, do 15 minutes of cardio, 15 minutes of weight training. But women, it's really important that you are pushing heavy things, doing weight training, challenging your body on a daily basis. And then you can start removing all the toxins, the plastics that you're drinking out of, that you're cooking out of, or you're storing foods in. Household cleaners, go back to the cleaners like vinegar, lemon, baking soda, and even a lot of essential oils are now used for cleaning. Hygienic products, as I mentioned earlier, cosmetics, deodorants, and those are the big ones. And shampoo, soaps, all of that. So the big one that I like to recommend, and I know Dr. Lucinda as well, is using more of a paleo template or a dairy-free keto template. We found that very successful. Doing a dairy-free keto template, because you're eating more proteins and fats, you're going to be full. You're going to be satiated, and you're going to be able to reduce your sugar cravings, and which is all the carbohydrates like pizzas, like pasta, like cookies, like pretzels, rice cakes, all that. So it's really important to follow a template that's more low carb. Some of the nutrients thyroid for the thyroid to work properly are these: tyrosine, zinc, selenium, vitamin M, and iodine. And you've got to support the liver and the digestive tract. So all in all, you got to know your numbers. You got to remove the stressors. Number two, you have to reduce the inflammation. Find out what's causing the inflammation. There's a lot of reasons. Some of the stressors are causing the inflammations, but sometimes it's not the outside, it's something inside. It could be parasites, bacteria, viruses, inside, but you don't know that by just looking at a person. That's the important of proper testing to be done. You want to fix the gut, optimize liver function. And you want to work with someone that's a holistic practitioner like ourselves, who they look at the whole body. We're like I equate it to we're the we're kind of like the SWAT team that goes in and just really looks at everything, or the private investigator, whereas the police just come and they like, oh, yep, there's a problem here. And then the special forces comes in and starts doing, really looking at everything. So you can kind of look at us as we're that special forces team of your health that's coming in and really picking things apart to show you and explain and tell you what's going on. So that's how we want to help you. What we're going to do is we're going to be offering, we do have a 4-week class that we're doing. It's a thyroid reset mastermind. And we'll explain more in details how that's going to work. But this is what we're going to help you with. The first week, you're going to understand what your thyroid does, and you want to know what caused your thyroid to malfunction. Everybody else is different, but you're going to figure out, why is it not working for you? And what exactly does it do? And you're going to be able to explain it to someone else, because if you don't understand it, you're not going to, and able to explain it to someone, you're not going to get it. And some other common symptoms that what does thyroid malfunction look like? There's more than just what we presented today, and there's certain tests that you can do at home as well. And once again, what is the root cause? What if the root cause is your liver? What if the root cause is your gut? How are you going to know? Well, you're going to know when we teach you this. And Lucinda, you'll be covering week 2.
Yes, week 2. We'll be teaching you how your thyroid works, what kind of testing that we'd like for you to do, um, and we'll explain thyroid medication, what's best for you, and what depends on your thyroid condition, et cetera, what your doctor's missing. So we'll explain everything regarding testing and medication week 2. And then week 3, we will dive into more nutritional support, foods, nutrients that will hinder you or help you, basically. So.
And then week 4 is all about advanced strategies and testing. So there's more than just checking the TSH, ferritin, cholesterol levels. There's more to that because we can look at labs, but at times your blood tests have always been the gold standard for a baseline, taking a look at everything. But there are other more sophisticated advanced strategies that really will help you dial in to that root cause. So if that's necessary, you're going to learn about that, and you're going to get some lifestyle strategies and hacks that you can start implementing today, and actually creating I always say we create our health by what we do today and what we expect in the future. So there's a lot that we're going to teach you, and how to put all of this information together. One, the food, the medication if you need it, optimizing thyroid, liver health, how to talk to your doctor if need be. So what we're going to be doing here is a 4-week thyroid mastermind. And the reason it's called a mastermind is because you just don't have the mind of 2 doctors working with you. We're doctors, but we're not your doctor. We're basically guiding people, and they have to make their decision how they want to go about it. You're going to understand it and be able to maximize thyroid function. You can do it with the drugless and a natural approach. And the beauty of it, when working with a mastermind, it's more than one mind that is working there, but also more than one mind, which would be a group of other women that have had challenges, and they will also share what were their challenges and how they overcame them, and just little tweaks that maybe others have done with their own health. It's really helped a lot. So basically what you're looking at is weekly Zoom calls for 4 weeks. They're 60 minutes, and we're all going to be there, and you're going to learn once again what caused your problem, what are you going to do, provide you even some recipes, what foods are going to build up your thyroid, what foods that you're eating now, they're probably healthy, but maybe they're not healthy for you. So you're going to be able to figure all that out. And how to work with your partners, your team, your doctors, and you'll know what each thyroid marker means. Because that's all we want to focus on. I mean, you're going to have a lot of other markers, but you're going to understand that. And do you really need thyroid hormones? Is it necessary? And one of our classes, that was a lady that just said, I just stopped taking it altogether and I feel better. So kind of interesting. Everyone's a little bit different. So you're going to get weekly handouts and guides. You're going to have access to the recorded meetings. So you're going to have to go back and listen, and you're going to pick up something new every time you go back and learn something. So you're going to learn to create your own meal plan and nourish your thyroid back to health. So we are going to be meeting on Tuesdays. Excuse me. Tuesdays at 5:30 to 6:30 in Zoom. We will be launching this class the second week of August, not August 2nd. So just a little there. So what is your investment for this? It's $497. It's a $2,000 value, probably even more, because with Dr. Lucinda's time and my time, I mean, our hourly rate would be combined $500. So you're getting us for 4 weeks. You're getting over 50 years of experience, and she's a master when it comes to thyroid and teaching women and learning what your proper dosage is. So it's totally, I always tell patients, you've got to invest in you, because if you don't invest in yourself, you'll never become that better version of you, and you'll never know until you try something. And for those of you who think, well, does my insurance pay for this? I just like to be very bold and upfront when when I talk about this, because there's some people that Dr. Lucinda and I, we do not participate in insurance companies. And we're often asked, why don't you, do you take my insurance? And our response is, your insurance doesn't take us because we practice differently. When a doctor is working with an insurance company, the insurance company is telling them how much time they can spend with you. They can spend 7 minutes with you. This is a test they can order. This is the time they can order this test. This is the kind of treatment they can give you. So the doctors can't even, those that are practicing, who are participating in insurance, are basically, they can't even practice medicine how they were trained, or they can't even think outside of the box because it's going to get shot down by someone saying you can't order that. And or also, I equate it to, there's two playgrounds. There's a playground where the insurance is, a playground where there is no insurance. The playground of the insurance, that's where all the doctors and all the practitioners are, and they have to wait to be told, you can go play on the merry-go-round now with your patient. You can go play on the swing. Don't push them too high. Okay, but you can only do it from 1 o'clock to 2 o'clock. No, 1 o'clock to 1:15. No, and they're always changing things. Whereas we're more in the free-for-all program where it's just like, you're going to be able to swing when you want to swing. You're going to want to be able to go on the merry-go-round whenever you want, because there's no one there to tell you what you can and can't do. Of course, we're going to have, you do it with guidance, but you're not limited what you can do. So you can go register here at drlindamarquez.com, Thyroid Reset Mastermind. Also, go on our websites. There's information that we both have. We've got videos, and we even have a free report, 12 things your doctor isn't telling you. So once again, it is a $497 investment. You're going to, by the end of this program, you're going to have a blueprint for what you need to do to fix your thyroid. Is it going to happen in 4 weeks? No, it's not going to happen in 4 weeks. It's just, there's a process. But when you have the blueprint and you start following that, you are going to feel better. You are going to feel healthier. You are going to have more energy. You're going to sleep better. You're finally going to get rid of some of that belly fat that's just been hanging on for life that you don't want to come back. So those are some of the things that you will get from this. So if there's something else you wanted to add to this, Dr. Lucinda?
No, just excited to start teaching all of you guys out there everything about your thyroid and how to have a more energetic life and how to optimize. We'll teach you eventually how to optimize all your hormones, but we're going to start with thyroid, and we will look forward to join you guys once a week in this quest. Thank you so much for having us.
Yes. Thanks you. Have a great day.